Hi, I'm Claudio Ferre, and I'm an assistant professor in the Department of Occupational Therapy at the Sargent College of Health and Rehabilitation Sciences at Boston University.
Hi, I'm HyunJoon Kim, a PhD candidate in Rehabilitation Science program at Boston University.
And we're very happy to share and discuss the results of our study that examined the efficacy of transcranial direct current stimulation in improving motor function in children with cerebral palsy. So this was actually a systematic review and meta-analysis that examined the efficacy of transcranial direct current stimulation across a series of studies and whether or not it actually helped improve both upper and lower limb motor function in children with CP. So HyunJoon, before we get to the results, can you describe in layperson terms what is transcranial direct current stimulation?
Yeah, sure. Basically, transcranial direct current stimulation is non-invasive brain stimulation technique that can be used to modulate individual brain activity by delivering weak current on their scalp. And as a supporting tool, combining TDCS with motor training or therapy that was originally designed to strengthen the connection between their brain and their each body part can show synergistic benefits.
And for someone who hasn't seen transcranial direct current stimulation before, what does it physically look like when you use it in the study?
There are nowadays there are many types of shape, but mostly the commonly used shape is like sponge on here. It's like square sponge shape. So they suck the water and deliver the current, so that helps delivering the current more easily.
Yeah, and I think that's one of the things that makes it such an exciting technique for pairing with therapy is that, as you mentioned, it's non-invasive and really just gets placed on the scalp using some sponges that deliver electrical current. So is TDCS applied uniformly, or are there different ways to do it?
Yeah, that's a good question. That is one of the main goal of our study. So basically, TDCS has two different types of electrodes, which is called polarities in our study: anodal TDCS and cathodial TDCS. Anodal TDCS, briefly, anodal TDCS, a positive current can be used to activate target brain region, and on the other hand, cathodial TDCS, a negative current or negative electrodes can be used to relax or inhibit the excessively activated brain area. And also, based on depending on the study purpose, we can stimulate different brain areas. So it is important to designing TDCS plan based on the goal of the study or goal of the treatment.
So it sounds like, again, as you mentioned, you can do anodal or cathodal stimulation based on these two different types of electrodes, yeah. And that has consequences for whether you're depolarizing or hyperpolarizing brain areas underneath those sponges.
Yeah, exactly.
And when you said targeting brain areas, again, maybe for someone who hasn't seen a TDCS or seen what the physical setup is like in an experiment, can you just talk a little bit more about how you might target specific brain areas in a study with TDCS?
Oh yeah. For example, if someone is targeting to improve their motor function or motor ability, they usually put the TDCS stimulation, put the current on the primary motor cortex, and yeah, if they want to activate the lesion sites of the brain, they usually put anodal TDCS on the lesion sites of the hemisphere. If they want to decrease the excessively activated brain area, then they put cathodal TDCS on the primary motor cortex area so that they can make a rebalancing the brain.
So you can imagine how it already starts to get pretty complicated, right? Because we're talking about different types of polarities with the different types of electrodes, but also the placement of the electrodes themselves are very important. It sounds like you can really target specific brain areas, based on where you place those specific electrodes. So can you talk a little bit about the rationale for this study?
Oh yeah. Recently, growing evidence suggests that TDCS can be effective method for improving motor function in children with cerebral palsy. But at the same time, there are large variability across the studies, including their settings or their outcome. So, through the meta-analysis using many studies at the same time in quantitative ways, we aim to explore the efficacy of TDCS and how we can effectively use TDCS to suggest how we can effectively use TDCS for strengthening the efficacy of original motor therapies or intervention.
Yeah, it seems like, with some of the discussion we were having earlier about, just the different types of ways you can apply TDCS and, the different montages and polarities, that there's room for some variability in findings that you may see in the studies. And I think, one of the really powerful tools of doing a meta-analysis such as yours is that you can really cut across and look for patterns that emerge, looking for consistent findings in these studies. So do you want to show some of your results?
Sure, I'd love to.
Yes, this is our main findings. As you can see in the first plot, each black square demonstrates the effect size of each individual study, and the red diamond demonstrates the overall effect size. Our overall findings indicate moderate to large positive overall effect. For our moderate to variable analysis on the electrode polarity that represented in the blue diamonds, we can see that only anodal TDCS showed significant positive effects with moderate to large effect size. In our second moderate to variable analysis on the stimulation site demonstrated in the yellow diamonds, only anodal TDCS applied on the M1 regions showed significant positive effects with moderate to large effect size. Yes, as mentioned, we performed subgroup analysis on the TDCS protocols that applied anodal stimulation to the M1 region, which showed significant effects in the moderate to variable analysis. In the subgroup analysis examining the inclusion of additional therapy, both TDCS protocols with and without additional therapy demonstrated significant positive effects with moderate to large effect sizes. Interestingly, the effect size was larger when TDCS was combined with additional therapy. In our second subgroup analysis examining the effects of TDCS based on the number of sessions, both single and multiple sessions TDCS protocols showed significant positive effects with moderate to large effect sizes. In our overall limb-specific analysis, only lower limb motor function showed significant positive effects with moderate to large effect sizes. However, the upper limb motor function did not show any significant changes. Importantly, in our additional limb-specific analysis that included only studies applying anodal TDCS to the M1 region, both lower and upper limb motor functions show significant positive effects with large and moderate to large effect sizes respectively.
So what would you say are some of the take-home messages of this study?
Yeah, through our meta-analysis, we suggest that TDCS may enhance motor function in cerebral palsy, and using anodal TDCS protocol showed the most robust improvements for their motor function. And then, especially the most consistent effects were observed when anodal TDCS was applied to the M1 region. So that could be our take-home messages.
Yeah, I think that's one of the strengths of this approach and of the findings is that, I think a lot of times there's some skepticism revolving, TDCS. And part of that skepticism, I think, is, well-intentioned and I think probably necessary, but some of the inconsistencies we see are probably related to some of these differences and the approaches people take when they do these non-invasive stimulation studies. And so, I think one of the nice things about this paper is that you can kind of wade through looking at these moderator effects and looking for what are the patterns that start to emerge if you classify studies based on these parameters of the stimulation protocols and how does that affect outcome. So what would you say are some future directions for this work?
Yeah, as we see in our study, TDCS has shown its potential for improving efficacy of motor training or more therapists. And considering that children with CP may have different neuronal conditions with typically developing children are refining the adjuvant use of TDCS while considering individual environment or condition may allow us to take one step forward in developing personalized intervention in motor rehabilitation in children with CP.
Yeah, I agree. And I think one of the things that's really critical for this area of research is really, for us as a research community, paying attention to how we report the parameters of the study, how we design these studies. I know in other areas of some brain imaging communities, they've published guidelines for what should be included in a paper when reporting the design, the analysis pipeline, and also sort of reporting of results in very kind of standardized way. And it seems like that's something that the TDCS community could really benefit from. And I agree. I think the future is really thinking about these personalized approaches. So being able to target areas based on some of these moderators that you find in your study, but also other things that are specific to individuals in terms of brain reorganization or the type of motor function you're trying to improve. So it's really kind of an exciting future avenue.